All right, cool. So with me right now, I have my friend Benjamin Colonna. I will let you introduce yourself, Ben.
Hey, how's it going? My name's Ben Colonna. My background is in industrial engineering, and I work in process improvement at the VA system and do some consulting work at other local Boston systems as well.
Awesome. Yeah, and so I've known Ben a long time. Well, he's been working at the VA and other hospitals, and I thought it would be a really good idea to bring him on. I've been talking with Ben just about like what they're starting to see. It sounds like where Ben works in Massachusetts, it's starting to see a spike right now. So Ben, we really appreciate you taking the time. I know it's really busy, but wanted to just get your thoughts on, short, medium, and long-term effects of this, and what might be some software that we can do. And I know you had some ideas around like specifically data and things like that that would be really interesting to dive into. Um,
Yeah, absolutely.
so, so what I want to start with is, just like short term, like what's going on right now, what like, what might be some, I don't know, operational things that could get handled. I know you're always thinking about software, so.
Yeah, I definitely am kind of one of the intermediaries in the hospital systems about balancing kind of software needs with operational needs. And so I'd say right now, in the short term, I think we are in a pretty stressed situation. And because of that, we kind of have to categorize things into priorities and set restrictions in certain areas where we can. So, I'd say in the short term, if we realize, we're going to be short in specific inventory areas or supply areas, that if we can figure out how to best manage the supply we have and set in certain criteria, kind of like, super strict or super open. I think that thinking with that in terms of kind of some of the current trends we're seeing across states could be really helpful. So I
Yeah.
think like in the short term, it's kind of, how do we manage limited resources we may have uh, with what we already know with some of the other early states in terms of trends and patient demands along those
Yeah.
lines.
And so specifically you're talking about like the masks and the ventilators and stuff like that.
Absolutely. I mean, I think those are the critical elements, but I think that there's other elements that also come into the supply chain. So, you think about test kits or swabs, those are also in that camp. Now, it's going to be different setting those criteria for those different supplies. I think, if we're looking about something like, test kits or something like that, we can set criteria and priorities with our clinical staff about who's the most important to test. And then if you think about, let's say on the PPE side, you can say, okay, well, here's our supply, where we're at, and some expected demand. How can we really get the most out of each unit of PPE, and what priorities and criteria can we set in that space so that we can try and make sure that we're going to be covered in all our camps across the board.
Hmm.
But I think that as we get more info on, more incoming PPE or test kits or other supplies, we can start changing those criteria. And we want to make sure that if we do change those criteria, that we're matching that up with what we're seeing with some of the earlier states in terms of expected patient demand.
Oh, interesting. Okay, so I think there's like kind of maybe two things here that could kind of plug together. So the there's tracking the what we've seen from other states as this kind of moves state to state. Well, not moves, but just spread. I don't know. Spreads like starts affecting different states at different times, like the peak happening. Um, so there's tracking that data and kind of predicting what the supplies might be. So there could be some pretty cool like data analysis there that we can that could happen.
Yeah, absolutely. And I think too, I think for folks like me that are really data driven, there's a lot of data out there. And I think, one of the challenges for someone like me is, I might have to go and try and hunt it down. And I think that's definitely a challenge in some of the times like these, where most of my efforts need to be kind of focused on, the operational side. So, I know that, departments of public health and the CDC is publishing a lot of data on trended positive results and total number of tests done. But it's kind of difficult for someone like me to try and track all that down in kind of a usable format. I think in the hospital, we pretty much live in Excel worlds. Might not be the most advanced tool, but anytime we can get, data sets exported to Excel, that's how we'll tie them in with maybe what our internal needs are within a specific hospital system.
Yeah, wow. So even something just as simple as like consuming data and exporting it in Excel could be
Yeah, just,
incredibly valuable.
like a good
Yeah.
data repository, that kind of brings in from various sources. I mean, you kind of have your national and high level information, on like CDC sites, but if you work at a smaller facility in some of the areas across Mass, you might think, okay, well, I could really use some specific Massachusetts data, which is pretty much on the Department of Public Health website. But
Right.
when you kind of go there, it's in Word documents or, PDFs. And, I would much prefer something like, just an Excel document with numbers in it, so that I can try and match that up with maybe what some of our needs are on the hospital side.
Yeah, well, maybe I know if you share with us the links, we can kind of connect it to this video, and teams that are interested in it can look at it. I know, I mean, ideally we could find some API or something like that that could be plugged into, but I mean, that could also just be part of what somebody researches and tries to find how to connect those data sources for
Yeah,
sure.
absolutely.
Yeah. Um, so the other side of that I thought was interesting that you mentioned is actually just like surfacing um, the new criteria or the new like hey, we're I don't know, and maybe I'm just interpreting this, but tell me if I'm wrong. It's like you have to make a decision like, okay, there's we don't have enough masks or something like that, like for us to operate the way that we've been doing so. So here's some new guidelines for like, hey, you might need to use the mask, one mask per day or something like that. Is that what you're saying? Like,
Yeah, absolutely. So it's kind of coming up with strategies to stretch what supplies we have, and I'll kind of go over two examples. So one example, let's say with the masks and the PPE, is we first set in guidance about here's ways that we can try and conserve and restrict PPE use within a hospital system. But then it also highlights other opportunity spaces, not only for this crisis but moving forward. Like, let's say getting our hands on things that could sterilize some PPE that we could reuse. So I think it kind of highlights some of those, and we can pursue those strategies. Now, adopting those strategies also comes with other challenges, like learning and implementing new processes. But I think that that's one example kind of in the PPE space where we can try and shape our, the demand that we'll need based off of kind of some incoming trends. So, and I'd say kind of the other piece of that would, let's say, if you want to talk about kind of testing, right? So like right now, if we're short on test kits, we're going to set stricter criteria on who we're actually testing. So we might not test anyone who's asymptomatic. Maybe they need to be an at-risk patient or a first responder. But I think as the supply increases, we want to be able to test more and more people, because I think, the more folks that we can test and kind of wrap our head around, the better we're going to be able to kind of respond to this effort and try and keep other people safe.
right.
And I think too, when you talk about some of those other data trends that we're seeing, at the, state and national level, those are other things to kind of keep an eye on, because some of the things that we're doing, like the number of tests, will impact those trends. So, if I think most states likely have some stricter criteria around testing, they probably need to be symptomatic or a first responder or an at-risk patient. And I think that impacts some of the data we see on both the state and the national level, about the number of positives, even things like mortality rate. And I think that as those criteria start changing with an increase in the inventory, it'll help us execute things better at the hospital level. But I think also we'll see some different trends on the data side on even the, sites like the CDC and Department of Public Health and things like that.
Right. Yeah. Okay. So it sounds like really there's an input problem. It's like we have a lot of different things that we, you know, we're trying to pull different things that don't necessarily match up and create correlations between those. So just having some way of processing that and surfacing that data appropriately, and then the output side of that actually getting, actually being able to determine what the criteria is for a test or something like that. And
Right. Yeah. It's digesting all that data that's out there, and how can we use that to kind of inform, operational decisions at the hospital level.
yeah, I could see it almost being like two different teams hacking on like one the input, one the output, and then maybe they combine at the end to make something, because that would be really cool.
Yeah.
Yeah. So, um, so what? I mean, so you're in operations, so I think it's supply and demand and making sure all that is managed operationally. I think yeah, that's probably where you're focused. Is there any other maybe like mid to long term problems that you're seeing, or it sounds like this is a pretty getting this right, at least the data consumption piece of it is a long, eventually turns into a long-term thing, hopefully.
Right. I mean, I think that's one of the things, right now, from an operations perspective, we're kind of, building the plane while flying it. But I think that we're using whatever data we have available to kind of inform those decisions. But as you think about medium and long term, I think that data is going to continue to become more accurate and more informative. So I think that if we can identify, like if you think about like mid and long term, trying to go back and match up, certain areas of the data and kind of see what that shows you, I think that really helps inform folks at higher levels about the impacts of certain decisions. So I think, if you look at various spikes across cities and states, and you could match it up with kind of, here's a major action that, let's say, a governor took about, a stay-at-home order, and you look at that state's data, I think that medium and long term, everyone's going to be looking back and saying like, okay, well, what was the impact of that? Did we see any decreases? And it's a complicated exercise, and I think there's a lot of really smart people doing it, but for folks like me, I'm interested in maybe just a couple really good data points that we can, tie to a trend. There's not enough time to build really complex models. I think there are folks doing that, but those, are all projections, and nothing is really perfect. So it's how can we figure out what we can use now, and then how's that going to inform us, in the mid and long term. And I think that's still kind of undecided. I think we're kind of learning as we go here.
Yeah, so I mean, it might just be experimentations with like data visualization of like, hey, on a state by state or even county by county level, like, hey, the different graph lines and stuff like that. So people can dig into the different trends and look at, oh, hey, this event happened here. Is that what you're saying? Like,
Yeah,
yeah,
absolutely. I mean, I think that it would, because if it's tying some of those things that we're doing to try and be proactive to manage this crisis, and if we're doing a certain actions at certain points in time, we want to know, what's the impact of that,
yeah,
and we also have to, understand that the things are going to continue to spread and progress, and there's not going to be a silver bullet, but the actions that we are taking, we want to know what's been impactful, and as the waves kind of continue, as things kind of start to open back up, how does that impact things moving forward? Because that's
right,
really when you start thinking about your medium and your long terms, when the first, governor says we're going to open up, Georgia again. Well, let's look in 2 weeks and see what was the impact of making that decision, and how's that really impact some of the hospital systems.
right. Yeah. I mean, we kind of have 50 different experiments going throughout the
Exactly.
country
Yeah.
right now. So,
So, I mean, and that's the thing, that's a lot of data that's going to be available, and it's really hard to kind of match up what what's important. So I think, someone to help start to get all that into one place, even in a somewhat usable format, I think is definitely a need, even on the, the front line, so that I can go somewhere and say, here's the way Massachusetts is trending, and I can export it to Excel and compare it to my own facility and, see, okay, here's what's happening. And if I can look at another state that might be in a similar demographic as mine, I could say here might be some things we can expect.
Right, right. Yeah, historians are going to be crunching these numbers for a long time. So us trying to
Yeah.
get ahead of that is going to be is going to be pretty important.
Yeah.
Um, so outside of like the data and things like that, as far as operations is concerned at the VA, I'm curious like how you all are recording tests and how like how that's happening, and not saying maybe it's handled and that's not something that can be helped with, but like as far as who's gotten a test and things like that, like are there systems built for that? Um, is it you know yeah, I don't know. I'm actually just very curious about that.
Yeah, yeah, no, so absolutely. And I mean, I think one of the big benefits of working for the VA system is they have a very robust, medical record system. And I think that the benefits of that are that we're able to really track the patients extremely well through this process and kind of ensure that no one's falling through the cracks. I think that some of our challenges are kind of coming on let's say the employee side, because not everyone who's an employee gets their care at the hospital that they work. And I think that when that happens, there's always an element of information that's just going to be a mystery, and there's a lot of human factors involved. And so when that is the case, and let's say it's something that's not, you're able to kind of pull out in a query in a medical record system, how do we kind of manage and track that data and information? And that's always evolving, and I think that's one of the things at the VA that has been a challenge, and we're continuing to try and tackle that the best we can. But yeah, it's an ever evolving situation.
Yeah. So I'm sure there'd be like a lot of HR stuff and a whole bunch of things that would need to be figured out. But I mean, some way for um, I mean, even maybe just prototyping could be helpful. Is some way of actually, um, having a record of who at the hospital has been tested, has antibodies, is cleared, like that sort of thing. That would that be helpful? I mean, and like I said, it's probably not going to be rolled out like because of all the HR concerns around that, but it could be something to at least get started. I don't know.
Yeah, so we have a couple of systems like that in
Yeah.
place right now. But again, they're not perfect. But we have to keep an eye on all our employees, and especially how they're moving even through the hospital system. So, I think too that there could be a kind of a more niche need there, where we're really looking at staff moving through a hospital system and where they might have been, and who they've interacted with, because from an infection prevention standpoint, that's always a challenge to try and kind of map out exposure rates. And I think, we're doing the best that we can to try and, talk with those folks that we are testing about what they might have been doing or where they've been, but it's difficult to kind of, piece all of those together, both from a data perspective, but also even just from a data entry point. How are we getting this information, and what would be ways that we could automate any of it. It's definitely a challenge, and I think that's something that everybody is struggling with, because it's out there. So
Right.
yeah.
Yeah. So I mean, things that help with just tracing. I mean, everyone's saying contact tracing. I know Apple and Google are working on that.
Hmm.
But I mean, it sounds like it's even more critical at like a niche level within hospitals and stuff like that. So I don't know. Could be something for people to mess with.
Yeah.
It sounds like for you the data piece is definitely like the most important. Um,
Yeah, I mean, and again, that's only because, that's my day-to-day work. I think that if you talk to, physicians and nurses, their needs are going to be way different than mine. So I think that it's just what expertise you have and what you need, and everyone's trying to, do what they can do to help. So, and data
Yeah.
is definitely just up my alley. So that's really my area of concern and things that I'm really looking at day to day.
Yeah. 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 Um, and on that, like with data, is there, have you seen any like other hospitals reporting specific data around like, how they've handled things? And would some, if we were able to get our hands on something like that, analyzing those sorts of things be helpful to you?
Yeah, so I think one of the benefits of, let's say, some of the, even just the sites that I've mentioned, is that there are a lot of reporting requirements, and we do need to roll up
Yeah.
a lot of valuable info. I think the one piece that's missing and kind of more of a challenge is, what are hospitals doing about certain things? I think you really kind of have to get that from the news or by kind of doing your own research, but if we can identify one hospital system that seems to be outperforming others, it would be, really awesome if you could figure out, well, what are some of their processes and procedures that could potentially be resulting to that, and like what you be able to adopt. And so kind of like an example of that is when, we were first gearing up for testing, we were looking about, how are we going to set up our, drive-through clinic for the hospital system. And, the first thing we did is really kind of cast nets out and say, who's already got this up and running? And, we got a documentation from Connecticut and the VA down there, but also the Yale medical system. And, it was a really helpful kind of blueprint for us figuring out what our needs were for that. But I
Yeah.
think, the same thing could be done if it could be, networked in some sort of way. If you see good positive data trends at a specific area, is trying to figure out and tap into what are, that system's operational aspects that could be kind of contributing to it.
Right, right. And so, yeah, since drive-through testing and all, I mean, all this stuff from an operational perspective is new. I mean, maybe even just some place for hospitals to be able to exchange blueprints on how they handle this stuff, like could be helpful. I mean, I'm assuming you're facilitating this over email, just reaching out to people right now,
Yeah,
or
for the most part, it's over email, and then there's I can try and track down some other sources where we might find operations, but a lot of that, it might come down as guidance from state or national level, or it might just be something where, we need to do something and we try and just reach out over our internal networks and say who's been working on this, or how have you been approaching this. Because
yeah, yeah,
again, it's also hard to say, here's how we're doing it, and even though we have great results, hospitals are complex organizations, and it's difficult to kind of try and replicate something exactly, but if you can
right.
use those as guiding principles, that's really helpful. And so I think that any sort of area where that could be organized or put together, I think could be hugely beneficial. But again, I think the challenge there is getting a hold of that stuff.
Right, right. Yeah, I mean, I'm from a development standpoint, I mean, we get a ton of resources around like, oh, how do I like how you know, how do I implement whatever like in a certain way? And we have Stack Exchange and all sorts of things where we can share code with each other, like in an open source way. It might be interesting to create something where hospitals can exchange procedure, like can share procedures and talk about it. I don't, again,
Yeah.
you know better than I do on that.
And yeah, I think that there are might actually be a couple resources out there already, which I can send your way.
Yeah,
And so those are kind of areas where we might try and see if we can find something.
yeah.
Um,
Okay. Yeah,
but
it'd be great
yeah,
to look at that and just see, again, I don't just trying to come up with ideas to help. So yeah, well, I mean, would love to take a look at it. We can link that in you know underneath this video or wherever we post it.
yeah,
Um, awesome. Well, Ben, I know we're at about time that we had scheduled, and I know you are super busy right now. So I really appreciate your time and don't want to take up any more of it than need be. But do you have any parting thoughts, ideas, things like that?
Yeah, no, I mean, yeah, I think we talked about a lot, and I think there's definitely some tall orders for, folks in your field now and in the future. So, I appreciate, you guys looking at it, and anything you guys can do to help, that'd be awesome.
We're gonna do our best.
All right.
Well, yeah, thanks so much. And I'll get all the resources from you, and we can share them with the teams.
Okay, great.
Awesome. Thanks, Ben.
All
Appreciate
right.
it.
Thank you.